Welcome back to Face the Nation. We want to go now to Governor Asa Hutchinson of Arkansas, a state that this week had its largest spike in hospitalizations since the pandemic began. He joins us from Little Rock. Good morning to you, Governor.
Good morning. Good to be with you, Margaret.
Thank you. I'm sorry to hear about this spike in hospitalizations. That means people are getting quite ill. Your infection rate's also up. I saw that your state was one of 15 that have added more cases in the past week than any other 7-day stretch. This doesn't sound like rounding the curve.
No, it's very concerning, and that's a statistic I watch, is both the deaths and the hospitalizations. I do think people who get ill want to go into the hospital quicker because they can start their treatment, they have a better chance of recovery, and so I think that is a little bit of a factor. Right now, our hospitalization space is tight. We have adequate space, but we watch it very carefully, and the spike in cases that we've seen is a concern. I think it reflects what we're all looking at nationwide in terms of going into the winter, combination of flu, the combination of more indoor settings, and so it is concerning, and we're making preparations for it, but we have to really pull together to follow the guidelines that are necessary to keep the economy moving, but at the same time, make sure we don't increase that spread.
When you say preparations are being made, do you need to set up field hospitals as alternates to your current hospitalizations?
We always, as the mayor indicated, have contingency plans, but we have more than adequate space right now in our hospitals. The challenge is, of course, that there's a lot of other healthcare needs that you don't want to reduce or put aside because you're dealing with COVID patients. So we have more than adequate ventilators, ICU space. Staffing is a challenge for our hospitals because it's becoming a national competitive environment to recruit staff with contractors to move them to hot spots and other places. And so that is the most consistent challenge that our hospitals are facing. Preparation-wise, we're working very closely with them, but it's individual responsibility of our citizens to do what is necessary and pull together. Increased usage of masks, you see in Arkansas in compliance with the mask mandate that we have in place.
That's interesting. You are a Republican governor. You are calling for more mask wearing. Our CBS polling through our battleground tracker shows that in virtually every state, when the question is asked, likely voters tell us the Trump administration's efforts have hurt more than helped states' COVID response. Is the fact that the president doesn't wear a mask and endorse it, even though he says he's okay with it, does that hurt your ability to persuade your constituents to do what you are telling them is best for them?
Well, it makes it confusing. I mean, he's made it very clear that wearing a mask is important. I saw him wear a mask going into the polls yesterday, but obviously with the rallies, there is confusing messages there. The president, leaders in crisis, always needs to do two things. One is to be truthful and realistic, and everyone knows that we are going through a very difficult crisis, and it's going to likely get worse as we go into the winter. Secondly, you've got to give the American people hope, and that is the vaccine that the administration is working incredibly hard for. I spoke with Secretary Azar this week, talking about the partnership with the states and vaccine distribution. And so they're working hard at the White House level, but the communication as to what we need to do is an important part of it as well.
I want to ask you about that distribution because Pfizer's CEO, when he was on our program recently, he said he thinks it's going to be really difficult for the government to handle distribution, and he thought it'd be better if they collaborate with private industry. Are you confident that even when a vaccine becomes available, you'll have full access and ability to get it to your constituents?
Well, actually, there will be a utilization of the private sector in the vaccine distribution. It will go directly from the federal warehouse or from the manufacturer straight to the point of distribution in the state, with the state acting more like a traffic cop as to make sure it gets to the right place. But the private sector will be absolutely utilizing this. These plans are still being developed, but we've submitted our plan. We'll be getting a response from that from the White House probably next week.
Okay. I want to ask you about another thing that our battleground tracker has shown in 3 different southern states, and that is when likely voters are polled, they say it's inappropriate for the president to lead the chant, "Lock her up," as he recently did in regard to Michigan's governor at a rally. You know, there's been an FBI plot to kidnap and kill her. That FBI revealed that they had foiled this plot. You're the top Republican on the National Governors Association. There are now threats that have been reported against multiple governors. Do you think it is appropriate to lead these kind of chants, given the level of tension and threat?
Well, that's not a chant I would ever participate in. You know, we need to have a more civil discourse. Even though it's a hotly contested presidential race, we need to lead by example. Whether it's a president, whether it's his staff, or whether it is a governor, any public official has threats made against them, and we have to take that security seriously. I'm very delighted that she's safe, but also that the law enforcement did such a great job on that case.
All right. Governor, thank you very much. Good luck to you. We'll be right back. We're back now for our weekly check-in with Dr. Scott Gottlieb. He joins us from Westport, Connecticut. Good morning to you.
Good morning.
You warned us last Sunday that we are entering what could be the hardest part of this pandemic as we get into these colder months. We're seeing these infection and hospitalization rates really jump. Where are we on the trajectory as you see it?
We're at a dangerous tipping point right now. We're entering what's going to be the steep slope of the curve, of the epidemic curve. We know what that looks like from the spring. We know what it looks like from the summer. These cases are going to continue to build. There's really no backstop here. I don't see forceful policy intervention happening anytime soon. We have a moment of opportunity right now to take some forceful steps to try to abate the spread that's underway. But if we don't do that, if we miss this window, this is going to continue to accelerate, and it's going to be more difficult to get under control. Now, in a lot of parts of the country, it doesn't feel really, really bad right now because it's a little bad everywhere. You don't have regions where it's extremely dense in any one region like we did when it was epidemic in New York or epidemic in the South. Outside of states like Wisconsin or Iowa, most states just have a lot of spread, but most states aren't at the point where they're extremely pressed right now. That's going to change over the next 2 to 3 weeks. I think things are going to look much more difficult. And so we need to take some steps right now. There is no public support for shutdowns nationally like we did in the spring. That's not going to happen. So we need to reach for other measures.
Well, you heard the National Security Advisor to the President say the focus on just protecting the vulnerable. The Chief of Staff, Mark Meadows, said on CNN, we're not going to get control of the pandemic. So is the point here just buckle up?
Well, I think that's what they're saying, but I don't think that's what we should be doing. There's things that we can do to slow the spread. I mean, a national mask mandate can be put into place. It doesn't need to be backed up with fines or stringent enforcement. We have other requirements that we expect of a civil society that we enforce with, political jawboning leadership. We give people warnings at first. So I think masks are one thing that we could be doing. We need to look at targeted mitigation, starting to close congregate settings where we know spread is happening. Remember, even if we get a vaccine this year, and I'm on the board of Pfizer, one of the companies that's pretty far along in developing a vaccine, even if that becomes available this year, and we get shots into the arms of the first tranche of patients, which is likely to be the elderly and healthcare workers, they're not going to have protective immunity until 2021, at some point in 2021, because it takes time for that vaccine to kick in and you need 2 doses. So this vaccine is not going to affect the contours of what we're going to go through, which is going to play out in the next 2 or 3 months right now.
And the CDC has said that masks are sort of the best plan for the moment. On that point, last week you told us that if someone's going to vote in person, for example, they should have a high quality mask. You said that meant not a cloth mask. Walk us through what the safest masks are.
Well, remember, the masks serve 2 purposes. One is to protect other people from you. So if you're asymptomatic or pre-symptomatic, if you have a mask on, you're less likely to expel respiratory droplets that can infect other people. The other purpose is to provide you some measure of protection if, in fact, you're around people who are infected. So if you want a mask to afford you some protection from other people, quality matters. A cloth mask may be 10% to 30% protective. A surgical mask, a level 2 or level 3 surgical mask, procedure mask, may be about 60% effective. An N95 mask or an equivalent like a KN95 mask, which is a Chinese equivalent, or what we call an FFP2 mask, which is a European equivalent to an N95, that could be 90, 95% protective. So if you want a mask to afford you a level of protection, wear a higher quality mask. If you only can get a cloth mask, thickness matters, and cloth masks with polyester in them and a combination of polyester and cotton do better.
Thank you. At the White House, masks are not mandatory, as we discussed with the National Security Advisor. And we know the Vice President had close contact with staffers who have tested positive. The CDC advises everyday people to isolate, to quarantine if they have that kind of contact. The Vice President is not doing it. Is he putting others at risk by campaigning?
Well, look, he could be closely monitored. So the short answer is yes, but you can closely monitor the vice president. I would understand why they wouldn't want to quarantine the vice president, but they need to be very explicit about what they're doing and the risks that they're taking. He should be wearing a high-quality mask, an N95 mask at all times. He should be distancing wherever possible. They should be serially testing him. And there's ways to try to provide a measure of protection around the vice president or protect other people from the risk that the vice president does contract the infection. But they need to be very explicit about the risk that they're taking. I think everyone right now in the White House should be wearing a mask. They have an obligation to protect the vice president and the president and not introduce virus into that setting. They certainly have access to proper protective equipment, unlike a lot of other essential workers that don't have that kind of access. They have access to serial testing as well. Finally, one last point. One thing they might consider for the vice president is using one of these antibody drugs as a prophylaxis. There's a belief that these drugs would work well in that setting. There's some risks associated with that, but you obviously do not want the vice president to contract this infection.
Right, and he would have access to something like that, whereas you and I would not have access at this point. On the vaccine, I do want to quickly get you on this because Operation Warp Speed, the administration's effort, announced this week their timeline. They say by the end of 2020, all vulnerable people will be vaccinated. By the end of January, all seniors will be vaccinated. By March or April 2021, they should be able to vaccinate any American. And the head of this, Dr. Mansif Slaoui, said he's confident by June, everyone in the U.S. should be immunized. Is that realistic?
Well, I think it's aggressive. Look, this is first based on a presumption that these pivotal trials that are underway by Moderna and Pfizer actually read out and demonstrate that these vaccines are safe and effective. We all hope for that. We believe that's going to be the case based on the early data, but you don't know until you turn over the card on those trials. Assuming things go well, there is a chance that they could roll out this vaccine in time to get the elderly population in the United States vaccinated, the first dose of the vaccine. But remember, they need to now wait a month to get the second dose, and there's a period of time of a week or two until they have protective immunity from the vaccine. So you're looking really at 2021 until the vaccine really kicks in. In terms of the entire population, I think it's unrealistic to think that we're going to have a vaccine widely available for general distribution and authorized by the FDA for mass distribution until probably the second quarter of 2021, later on the second quarter.
Understood. Thank you, Dr. Gottlieb. We'll be back in a moment. As part of our continuing efforts to hear from voters in the coronavirus pandemic, on Friday night, we Zoomed with 6 voters, evenly divided on their voting preference. They were also divided on their thoughts about the impact of the virus on this campaign. We're looking at numbers across the country. And I know, Chelsea, you are in Indiana, I believe. So you're right in the middle of the Midwest where there is a tremendous spike right now. What do you think the impact will be on the election from COVID?
Generally, I think the lack of response is energizing people to vote. I'm pretty positive that just how chaotic this has all been and that there hasn't been like a very clear, this is what we should be doing, has really frustrated a lot of people. And because of that, they want to see someone else who might actually have a plan or might try and take charge.
And what is it that you see in Joe Biden's plan that makes you think it would respond to the crisis?
Well, actually, like listening to scientists, you've heard Trump call Fauci an idiot, which I think is really dangerous. He's gone back and forth. Well, hasn't really actually even taken a position on mask wearing. Joe Biden is at least, for mask wearing.
My concern with the coronavirus is quite simply, there's not been any transparency about it. I'm very concerned about that. When it first come up, it didn't seem, and maybe I was missing something, but it didn't seem as important as it should have been taken from the very beginning. But when you make a mistake and say you can take bleach and cure the coronavirus, and then you get on national TV and say you were just kidding, well, people are dying. Families are impacted. Loved ones are impacted. Seniors, you can't get on television, no matter who you are, and say, take bleach and you were just kidding. That's nothing to kid about.
Will all of you, show of hands, take a vaccine when one becomes available? Mildred, I was reading that you miss hugging your grandkids, and the social isolation you're in. You still don't want to take a vaccine?
I do want to be around for my grandkids, and I think being, a guinea pig first out, I won't be here for my grandkids, and I won't get that hug. So therefore, I won't be the first one taking the vaccine.
No vaccine is 100% effective, especially with the viruses, because they mutate so much. So I just think that Trump has put his foot up the collective butt of the FDA to get them to do their job in a timely manner and not just push paper like bureaucrats typically do.
So you would take one tomorrow if it became available?
Absolutely.
Dave, you too. You're saying yes.
Oh, absolutely. And it's not up to him to release the drug. It's the FDA.
Mm-hmm.
You listen to Trump all you want, but until the FDA releases it, you're not going to get it anyway.
I wonder who all of you think bears the most responsibility for the spread of this virus in the United States. Do all of you believe in wearing masks? Can you raise your hand if you wear a mask? Beth, you don't wear a mask?
I do when I'm in public spaces where they insist that you do, but otherwise, no.
And so when you hear the statistics that are rattled off by the CDC director, or you hear Dr. Fauci say wearing a mask could really stop the spread, why do you doubt that?
Because the virus is a virus. The particle is so teeny tiny that it can't even be seen without a microscope. So, I mean, while prophylactically, and yes, out in public, it may help. And certainly if I was around someone who was older and was ill, I would do it. But the virus is the virus. It's so small. It's going to do what viruses do. So I think that your best offense is a really good, strong defense. Be healthy, eat well, exercise well, sleep well.
Do you believe that the United States could have done better in its response to the virus? Show of hands. Beth, Dave, and Walter, you all think that the response was adequate. Walter, you've lost friends.
How do you respond to an unknown when you have absolutely no idea what it is? They acted to take care of people as best they could, but you're shooting from the hip. Nobody knows. I think the job that was done was magnificent compared to the circumstances.
When you look at the population in the United States and the access that is here, why don't you think that America should be leading the way?
I think we are leading the way. I think the reason, I think the biggest...
Even though we have about 20% of the world's fatalities and 4% of the population.
And all of the traffic that had come into the country with the disease, whether they knew it or they didn't know it. And then in many of the instances, the way the states handled or didn't, like New York, completely screwed up their response. Inflated the death rate.
So take President Trump out of it. Are you telling me that fault really lies with local governments?
On the state level, it's gotten to a point, and it was obvious from the outcomes in New York and New Jersey that what they did was completely wrong.
Somewhere along the line, the responsibility for taking on ownership of the virus and what needs to happen and should go forward, it was communicated it's the governors who run the state's responsibility to do the things. The governors didn't know what to do. I know the governor of Georgia.
Well, nobody did.
Nobody did. But the buck stops In my household, what happens here, I'm responsible for it. I'm responsible. So I can't do everything that needs to be done, but I'm going to try to exemplify and take responsibility, acknowledge and take responsibility, and go forward with it.
I think it's just kind of wrong to say that Trump couldn't do anything because that interview came out where, I don't remember if it was in January, February, he knew how deadly it was. He knew how it was spread, yet he still didn't do anything. He said he didn't want to create a panic. People panicked anyways. I mean, you couldn't go to the grocery store, buy any toilet paper, get your groceries.
He didn't say anything. It's not that he didn't do anything. He didn't say anything.
Well, I think in this case, like, he absolutely needed to say something because people were going around blindly, not knowing what to do. If there was, some kind of response from him, maybe governors, local governments might have had an idea.
He did act. He shut down flights into the country, for which he was vilified for. Now the same people who vilified him for shutting down the flights are saying he didn't do enough. You can't have it both ways.
The CDC even said that, even if he didn't shut it down, it wouldn't have mattered because the virus was already here. And yeah, he did say something, but he waited months to say something. It's unforgivable.
January 31st.
But there was no response nationally to what states should do until March.
But you don't know what you're dealing with. It's just like a fireman going to a fire. They assess the situation and they move in. This is a lot different. You can see the fire. This you can't see. I don't think anybody could have done anything better.
I want to give Mildred the final word here.
I don't think they knew what to do. Then when they started to think about it, you've got politicians and money that became involved. And so the waters got muddy, very muddy. And I just think a lot more could have been done to save lives at the federal level, at the state level, and at the local level.
We'll be right back. That's it for us today. Thank you for watching. Next Sunday, we will join you from our CBS News election headquarters in New York. Until then, for Face the Nation, I'm Margaret Brennan.